Good afternoon, everybody. And my name's Jenny Smith. I'm the CEO of your Victorian peak body for ending homelessness, the Council to Homeless Persons. And I'm absolutely delighted that you've all somehow find a way to rearrange your incredible schedules to be with us this afternoon. If I could begin by acknowledging the traditional custodians of the lands right around Victoria, upon which we're meeting today. Personally, I'm here at CHP's office on the lands of the Wurundjeri people of the Eastern Kulin Nation, and I pay my respects to elders past, elders present, elders emerging, and any elders that we have here with us this afternoon, and acknowledge that these lands, not any of them, were ever ceded. Now, crikey, it's nearly 150 of you here at the starting point. So I think most of you will be here because of the news about our budget outcome. But in fact, the initial reason for convening this forum today is to assist the department to get some feedback post-haste that they need in terms of the innovations that we have put in place during our long and challenging COVID experiences, to give them some advice about what you might take forward. So we'll do that first, and then we'll go to Sherri for the budget update. So I'm delighted to introduce to you Una Bishop, who's the Deputy Agency Commander Specialisations in the Division of Readiness, Response and Emergency Management in our DFFH. So over to you, Una. We've got to unmute you. Good, there you go.
Beautiful, thank you. I'd also just like to join Jenny in acknowledging Victoria's Aboriginal people as the first peoples and traditional owners and custodians of the lands from which we are all joining today, and pay my respects to elders past and present, and any Aboriginal participants who are here with us today. So thank you, Jenny, and everyone here for coming together at very quick notice. We know it is a very busy time and really appreciate you making the time today. There is, first of all, a really important, I think, acknowledgement that needs to be made of all the work that this sector and US organisations and providers have done over the last 2 years in what has been a very unprecedented time, which is a word that I know has been laboured and probably lost a lot of meaning over the last 2 years, but your services have played such a vital role through the pandemic, supporting people who are at disproportionate impact of COVID, and we are immensely appreciative of the leadership and the innovation, as Jenny called out earlier, but really wanted to come together because the environment, as we are very used to, is continuing to shift in pandemic measures and responses and management, and really want to begin a conversation with all of you about how we manage that transition and ensure that there is a confidence moving forward in how services will be provided in a living with COVID context that is going to be somewhat different to what we've experienced over the last few years. So as many of you will have seen, attached to the invite for today's forum was a transition preparedness stakeholder pack. It was a set of slides in a PDF, and we've also provided a consultation questionnaire if there's more detailed feedback that you'd like to provide outside of today's forum, acknowledging that there's probably a few matters that that are for discussion today. So given that slide pack was circulated ahead of the meeting, I'm not proposing to share slides, but might direct you first of all to slide 4 from that pack, if that's helpful, just to emphasise some of the key changes that will be occurring, I guess, over coming weeks and months, which are really sort of premised on a less interventionist model of COVID management and fewer restrictions going forward, which you probably also heard in comments from the Premier and the ministers and coming out of National Cabinet over recent months as well. So throughout this year, as part of the third year of the pandemic, it's very much anticipated that COVID measures will be simplified and reduced. We are very much expecting that at some stage, due to improving epidemiological data and also the broader set of, I guess, preventative measures that exist through vaccinations and through broader social screening tools like rapid antigen tests, that the pandemic declaration will be lifted at some stage this year, and that remaining orders will transition into more general guidance, other regulatory measures, or potentially will just cease altogether. And we're still sort of working through with health how information and guidance will be issued, but we do know that will consolidate over coming months, and that's certainly something that we'd really welcome any feedback or advice from yourselves in terms of what has been useful to date and what you might require into the future. In terms of actual responses going forward, the large-scale interventions such as statewide contact tracing, testing and vaccination hubs will be wound back, and there'll be a shift to more localised responses that are led by local public health units. At the same time, there are some key changes that were announced last week as part of the state budget, which impact also on the DFFH COVID response, which some of you will be familiar with. So while local public health units will remain and COVID positive pathways will remain, there will be changes with the DFFH footprint in terms of our internal COVID outbreak response, and then also the partnership approach that we have with community health services to support residents in what has been known as high risk accommodation response, which I know many of you will be familiar with. So in that context, and I should also say, however, that the COVID isolation and recovery facility will be continuing post 30 June. But in that context, with those changes in terms of dedicated responses from DFFH, one of the things that we were keen to start talking about today as well is winter preparedness and how we can better understand, I guess, where you as sort of services and providers are feeling in preparation for that transition to greater sort of self-management, and some of the things that we can collectively I guess, reinforce and provide support on as well, particularly to existing local-led prevention and preparedness activities. So in particular, how we can support review of existing infection prevention control procedures, ensuring that we are keeping them current and up to date. As I mentioned, there will be some changes in terms of government information, in terms of what's published in terms of guidance and advice, and we would really welcome feedback from you in terms of what has been helpful over the last 2 years. The use of rapid antigen testing and other measures that you may want to use with staff and clients, as well as a continued emphasis on vaccination status and keeping up to date with vaccinations, both with flu and with COVID. And then also business continuity plans and approaches to supporting continuity of staff and continuity of service. So appreciate that's a big bag of issues, but this is really hopefully the start of a dialogue with you about this transition and the supports and advice that would be welcomed and valuable as we transition to COVID safe delivery in a very different context. So I might leave it there, Jenny, and really open to the floor for questions or clarifications, and really feedback, which we would find very valuable in terms of informing our planning for this transition.
And just because there's a lot of people and not much time, Una, just the key thing you'd like feedback on today, if you can. And if people could put their hands up, I can see Peter's there, but if people could put their hands up, I'll go to you first.
Well, I guess if it was to distill it down to one question, readiness to work in a context with a reduced DFFH service response, and what would be valuable in supporting services in managing that.
Thanks, Una. I think people can make other comments and ask other questions, but that's great, very helpful. So over to you, Peter McGrath.
Thanks, Jenny, and hi, everyone. I've got a really quick question. In terms of discussion with the Department of Health about the overlap with the flu season and the COVID season, sort of what kind of resources can tap into covering both of those demands? Because we're seeing it both with clients and staff that intersect right now as we're heading into the winter period. So in terms of resources from the Department of Health to make sure that we've got access to resources around the flu, is there linkages between the two?
It's a fantastic question, Peter, and I think is very much front of focus for us in our discussions with the department at the moment, and particularly in understanding what local public health units will be able to work with community service sector organisations on from 1 July. So it is certainly something that we are continuing to discuss with them. I'm afraid I don't have a definitive answer for you yet, but this is also really useful to be able to take back and say that we've sort of received requests for further guidance on that as well. And that's why I hope we can continue to have a dialogue on this over the next sort of few months.
Thanks very much. I think Lisa Samet, you've got your hand up.
Hi, thanks a lot, Lisa Samet from Salvation Army Melbourne Metro. Just wondering what sort of assistance we could get for air ventilation units, funding for air ventilation units.
So I think this goes back to sort of COVID safe planning that different organisations will have in place, and infection prevention and control advice. So certainly there is the opportunity to provide some general advice to organisations about different aspects of ventilation in terms of dedicated air scrubbers or units of that nature. There's not at this time an anticipated provision of these broadly, but certainly we can work on advice and principles about when they would be of best use and relevance, noting that there's a number of different measures that may be of impact and of value in managing COVID safe service delivery, not just ventilation.
Thanks, Una. Thanks, Lisa. No more hands are up. Just Peter and Lisa so far. Vicky's there. That's great. Over to you, Vicky. You're on mute. There you go.
Thank you. So if we're moving, I mean, 2020 is becoming, 2022, COVID's still in our community. And if we're moving from a department-led approach to an organisation-led responsibility, I think there's a few really important things to consider. RATs have become a really important tool for us in keeping as much of our workforce coming to work as possible. PPE is very important. We actually have an internal COVID response team as well, supporting our services, interpret advice. And if we're not getting that directly for department, that's going to be increasingly important. I think consideration for how the department actually supports ongoing funding for services to bed in some of these things. If the intention was no longer to provide RATs or provide the PPE, I think there needs to be consideration for that. And that links with Lisa's question around airflow, and if there's requirements on, substantially improved airflow versus pre-COVID levels, then there has to be consideration for how community service organisations can be supported to implement that new infrastructure.
That makes complete sense, Vicky, and thank you also for the direct feedback on the utility of rapid antigen testing as part of safe service delivery as well. It is something that we are continuing to work through as we plan what the next stage of this transition is going to look like.
Thanks, Vicky. Thanks, Una. I've got a question in the chat from Claire de Boyer from Launch Housing. What will be the changes to the reporting of COVID cases for high-risk settings? Do we need to report cases to the local agencies instead of Homes Victoria? I'm not sure what the local agencies is, but is there any change to the reporting requirements?
That is a really fantastic question, and thank you for asking it, because it is something that I probably should have emphasised in my initial comments. So at the moment, there continues to be a DFFH outbreak notification mailbox that will continue for the coming months. But in addition to that, I think something that we are seeking to sort of crystallise some more definitive advice for organisations and for community abroad is the importance of notification of positive RAT outcomes through the notification portal, because I think this will increasingly become the pathway for seeking support, particularly as we transition from having some targeted hurrah-led community health support on the ground in a number of our settings. The transition to the use of the RAT notification portal is going to become incredibly important for people to be able to access specific supports in managing their COVID illness.
Okay, thanks, Una. Now, there aren't any more hands up. So I wonder, Una, if in terms of there are 3 documents on it, Jeremy's got his hand up, but not his camera on. Over to you, Jeremy.
My apology. Just the very last sentence that was mentioned there regarding hurrah response. I'm not sure. And you referenced earlier, Una, the obviously there's a direct intersection between the high risk accommodation response and the work of, in the broader supported housing sector. Of course, hurrah is not funded post June 30. And I'm very interested as a partner agency in the hurrah program around what your understanding of the expectations might be for partner organisations in hurrah and perhaps community health, who are central to that, in continuing that work, or an expectation around the continuance of some of that work that's not funded.
So again, thank you for asking the question. So we are not even a week out from having understood health budget outcomes as well. So we're doing a lot of work at the moment to work in partnership to understand what has been funded as part of the ongoing health response, what aspects may be able to continue some of the prevention and preparedness effort that was so successful as part of the hurrah arrangements. And we are also looking at what partnerships and capacity building might be required to support local public health units to step more directly into sensitive settings in the absence of there being a DFFH COVID response as well. So as mentioned, any insight, any advice that you would like to share with us either here today or through the questionnaire as well, in terms of what has been the most valuable aspects of that program and things that you would like to emphasise would be very valuable.
Yeah, so well, I'm more than happy to share a model that hurrah funded, and there are other hurrah funded agencies sitting on this call, I'm sure, but some work was done with VHA in the development of a model that you're nodding, you look like you're aware of that, but captures all the best elements of that work to a point where I think the sector is genuinely, at a time when we get used to surprises, genuinely surprised that work has not been funded moving forward. And I think rather than me unpack all of the benefits of that work here, because we're under time pressures, making sure that perhaps that model is in your hands and perhaps can be shared with partners, because there's a lot of learnings for the whole sector around Hurrah worked as an amazing approach. So I think that's the best way to do it.
Yeah. Look, I can share that we are having very regular and constant sort of discussions with the community health part of Department of Health at the moment, and I'm very happy to report back and provide more information as things become clearer in a post-budget context.
Thanks.
Thanks, Jeremy. Una, can you put the best email to send the template to? Just to underline that in your diary invite for this meeting, there are 3 documents. 2 are a bit out of date, but the template remains relevant. And if you've got things to say about issues or best practice to share with the department, then that would be a really good idea. So look, let's make it 2 more quick questions if we can, and then we'll move on. What will be the equivalent to the surf in rural areas? Comes from Chris McNamara, who can speak for herself, but there you go, I've done it.
So thank you, Chris, for the question. I'll respond sort of briefly, but happy to get a more detailed question. So the SURF funding that we have received is to continue the offering that is at Sumner House. As I'm sure you're aware, based on your question, there is not a corollary offering in regional areas, and we would be continuing to work with COVID Quarantine Victoria on patient transport for people who would be eligible for SURF isolation accommodation to be able to relocate to Melbourne.
And then the last question is COVID trajectory generally from Casey Elmore. COVID trajectory generally shows large increases in winter months. While acknowledging that the SURF will still be operational, it may reach capacity quickly. What recommendations do you have for organisations that work with people experiencing homelessness who may be COVID positive but cannot access the SURF but need to support an individual with isolation?
So as many of you may be aware, we do now have the Victorian Quarantine Hub at Mickleham operational. If there is need beyond the SURF for emergency accommodation, that is definitely a facility that can be leveraged and drawn upon for people requiring isolation support. Until 30 June as well, we will continue to have the Relief and Community Support Integrated Services Support Complex Care, which is also another resource to draw upon for clients who perhaps have other support needs in addition to emergency accommodation.
Thanks, Una. And then Vicky Sutton wins the prize for having 2 questions, but she wants to know, can we buy any more time for filling out the template? What's your absolute deadline before you won't be able to use our feedback?
So the feedback is always of relevance. So we will be continuing to plan and have obviously concern for how we support community service organisations delivering services in a COVID context. However, there are some immediate milestones for government consideration, which even if you wanted to provide some very high level and fast feedback, would be very welcome in the next few days.
Thanks, Una, and thanks so much for being with us today and opening up this, I think, channel of communication. And I think everyone will get from Una that, you know, she's up for this being a conversation. So you've now got those contact details, which I think we can keep going. So thanks so much for being with us today, Una, and we hope to be talking with you more as the winter descends upon us.
Thanks, Jenny. And as I said, I am very appreciative of everyone coming together so quickly. Keen to make sure that people were aware of some of the implications of changed program context following the budget, but as I have probably emphasised, there is still a lot of detail to work through, and look forward to being able to provide you with more information as we go forward.
yeah, and I'm sure there are some brilliant examples of innovative practice that our sector will pass on to you. So look, we'll now move on to probably the main draw card for 192 people being on the line as we speak. And we last Tuesday had the announcement of the Victorian budget, and I hope that you're all aware that CHP is very disappointed with a major aspect of that, and I draw your attention to last week's e-news if you'd like a summary of our concerns. But fronting up today, actually looking ready for the gym, actually, which she might need, is our own Sherri Bruinhout, Executive Director, Housing Pathways and Outcomes, Homes Victoria, DFFH. And Sherri's going to give us an overview of the budget from the government's perspective. Thank you, Sherri.
Good on you, Jen. And I'm hoping this is not the equivalent to a workout at the gym, but I am in your hands.
The best.
So, team, also want to acknowledge that we're meeting on Aboriginal land, always was and always will be, stolen land that was not ceded, and I pay respects to Elders past, present and emerging. So team, I thought maybe a good way to go would be give you a bit of an overview of what was in the budget, and then maybe open it up to questions. Does that sound okay? All right. So we had a couple of lapsing funding bids. This is where Cabinet had allocated time-limited funding to a couple of programs, and that time was nearing an end. So there were a couple of budget bids that were successful under that lapsing program. So the youth foyer in Kangan TAFE, you might have seen that as a line item that was funded for another 2 years, as was the Salvation Army After Hours program was also funded for another couple of years. So I'm sure that I can see Karen, I can see Peter. I'm sure that's happy news for those agencies to have that funding certainty. There was also some new funding that was announced. That was around $74 million of new money coming into the sector. So that's for some multidisciplinary teams to support people experiencing homelessness. And it also included around 20 million for a new homelessness facility congregate site in line with Housing First principles. And it also included funds for our very first Aboriginal access point. So acknowledging that the needs for a culturally specific front door for Aboriginal Victorians into the homelessness service system. We're still, so team, you got the budget outcome on Tuesday, so did we. So we're making our way through that budget decision. Obviously we put up the business cases, so we've got a good sense of what we think it is, but often it's a variation on the business case that went up. So we're just working through how to best come at that 74 million. So that 74 million is over 3 years. And in the budget papers, you would have seen that the apart from the capital component, the service component starts at about 7 mil and then grows each year. So it's a budget bid that grows over the 3 years, but also time limited. So we look forward to proving what a great program that can be and building on that. In response to some of the advocacy, the very strong advocacy from Council of Homeless Persons regarding the Homeless to Home program, I guess what I would draw to your attention is, while you didn't see a line item in this year's budget papers, if you go back to the 2020-2021 budget papers, you would see that there was a 4-year allocation in the out years for specifically to the Homeless to Home program, which rolled out for $84 million for that first year, 2020 to 2021, went on to 42 million and then 12 million for the final 2 out years. So that program does have that budget allocation included. It wasn't announced this year because it was announced a couple of years ago. So we're also working through what does that mean. We know that there were unexpended funds and carryover in those funds. So we're working through, of that budget announcement 2 years ago of about 150 million, how does it actually roll out over the next, over this coming year and the following year? And doing some internal work on what that means, particularly for people who are in packages and particularly people who are in head leasing properties. So there's a enormous amount of work being done at the moment to take those government decisions and do some work in here about what does that mean and how do we interpret that and how do we get continue to get great results for Victorians who need it. So I might take a breath there in terms of that's the overview and open it up to questions or comments.
So Sherri, just before I open it up, and if people could put their hands up if they'd like to make a comment, can I just ask you to run through those, year on, I know it's 12 million in the 3rd and 4th years. What were the 2 figures in year 1, year 2 for H2H?
Yeah, so this is public information. If you so I'm not
last
sharing
budget.
anything out of school.
Yeah, no,
so
it's last budget. We saw it, yeah.
Yeah, so it's actually it's the 2020-2021 budget, and it's in budget paper 3. And you'll see there that there is a line item, homeless to a home, $84 million in 2021, $42 million in 21-22, and then 12 million in the last 2 out years. So that's 2022 to 2024.
Yep, so greatly appreciated, Sherri. Well, I'll throw it open to questions, and we've got Darren and then Jane. Thanks, Darren. Or comments?
Thanks, Jenny. I've got some, I guess in the budget there's some good news and then there's some concerns. So I think I'll highlight both in relation to Aboriginal Victorians. So the first comment I want to make is that I'd be very concerned if there's any reduction in services funding for homeless to a home that impacts on unwinding gains or reducing Aboriginal people's ability to be housed, because as you all know, Aboriginal people are about 16% of the clients of homes to homes. And Victoria has an absolute crisis in Aboriginal homelessness, and we don't want to see any further risks of exacerbating the issues. I also had some broader concerns. So I do have some sympathy for the Treasurer's comments about investing in unreformed systems. Aboriginal Housing Victoria's commissioned some work and done quite a significant piece of work to develop a reform package to turn around Aboriginal homelessness. And it included a costed implementation plan. And while Sherri's made the point about the Aboriginal access point, so there is some funding in the budget to start the work. And, you know, we express gratitude that there's a starting point, but I'm extremely disappointed that it hasn't been resourced in full, and Aboriginal Affairs is littered with the examples of partly funded initiatives, bits and pieces being funded and never actually getting to any kind of systemic reforms that actually bite. And the reality is the lack of funding in the homelessness system is locking our most severely disadvantaged people out of society and exacerbating the issues they face. And my last point is the work that AHV commissioned can equally apply to the broader homelessness system as a bit of a template. And we're more than happy to share. Thanks, Jenny.
Thanks, Darren. I'll look forward to having a look. And thanks for your comments. Sherri, did you want to say anything about what Darren had to say at this point?
Yeah, look, like you, Jen, I look forward to the launch of that report and sharing it with the sector and having the feedback from the sector. You're right, Darren. All reform has to start with a single step, and I think what we've seen in this budget is, from my perspective, really encouraging that that step has been acknowledged and gives us something to build on. But you're right, there's a fair way for us to go.
Thanks, Sherri. Jane.
Thanks, Jen, and Sherri, thanks for that overview. Look, I have to echo Jenny Smith's comments, both in e-news, but also today, and also her very, I thought, very good question of the Treasurer at the budget breakfast last week. And Sherri, I think that whilst I acknowledge that there is $12 million still in that budget line item, and it was announced last year, we're sitting on a huge program that has started to deliver some incredible outcomes for people who have really been through the ring, and not just for the last 2 years, but many of them who've had, chronic experiences of homelessness. And it's just devastating. And perhaps we've been a bit spoiled recently, but it's just devastating that, the government hasn't seen fit to at least give us a bit more of a vote of support of the hard work that the sector's doing, but also that people are doing, to get out of homelessness. I do acknowledge that you're saying there's got a lot of work to be done, but that said, we've got people who are about to become homeless again, potentially. We've got head leasing that are running out. We've got people who are then those that were lucky enough to perhaps be in public housing or in longer term housing outcomes, they're going to be without support. And, we know that housing without support doesn't work. We know that we've got to have the housing, So I guess I'd be interested to know, what conversations went on to make, for anything to be thinking that this could be sustained, at a $12 million level program coming down off the back of, where are we this year? $42 million. It's a significant drop. And I think one that a government that's had a really good record of addressing homelessness and great record with the big housing build, it's one that I feel incredibly flat about.
Thanks, Jen. Thanks, Jane. Maybe just in response to that, Jen, if that's okay, I would really caution the sector at this point in time from making comments like people will be without support, people in head leasing will be homeless. We got the budget outcomes last Tuesday as well, and we are working through really diligently what the current status is of the budget of the Homeless to Home global budget, what's in that budget, what's carried over from that budget, and making really doing a lot of work here behind the scenes. So we would like to come out and talk to the Homeless to Home providers in the very near future about our responses from the department about what that program needs to look like moving forward. So I guess my ask is if we can hold off talking about people in head leasing being made homeless or people in housing without support, and give the department an opportunity to work through some of those numbers and some of that understanding some of the decisions that came out of the budget announcement, and come out with some advice to our funded agencies about what that looks like. I hear the passion and I hear the concern, but if you can just, like I said, we've only been working this for a short period of time, and we just we'll come back to you with how we'd like to see it moving forward.
Thanks, Jane, and thanks, Sherri. And Sherri, I don't doubt the work that's going on to do a loaves and fishes in the background there, but I don't think that's abating our concern about where we're heading with this. Peter McGrath's next.
Only if I unmute myself. And look, I'll put this that I'm looking forward to the fact that the money has been committed for the sector reform. I think this is something that obviously we've been conversations with for time before COVID. So it's good that the government has invested into sector reform, and obviously the sector itself, we've got an opportunity to be part of that. And I do appreciate that after our support is continued to be funded, obviously it's important. I think it's an interesting point Jane raises around sort of the continuation of the support, because actually Homeless to a Home was a great opportunity and it created such a great movement for those who we had worked so hard, who are complex and long lasting. And I think what my question comes in a slightly different way is, with the work to do that, it actually took some pressure off the crisis system. The crisis system is still working to an over demand, and St Kilda Crisis Service is one that continues to get a high level of contact. And now we're going to have this evolving space where the resources are back to what we were pre-COVID. But I suspect that what we're going to see is the demand is still going to be high with the cost of living increases back to our crisis service. So I think what was levied out of H2H is fantastic, because it actually took pressure off the crisis services. And if we can definitely look at support, and, you know, I don't want to put my assumptions that this potential was a easy as you go budget until we hit an election, but I think in terms of trying to advocate to continue to look at those longer term processes is one that I think the sector needs to continue to support. So not a question so much, Sherri, just a comment.
Thanks, Peter. Sherri, did you want to say anything there? No, okay. So Dee, you're next. And you're on mute, unfortunately, still. Yeah, I'm good at that too.
Oh, it's different functions on Teams, isn't it? Yeah, thanks, Sherri, and thanks, Jenny. Yeah, I appreciate that. Obviously, Sherri, you and your team are working through that transition period, and that's going to take a bit of time. But if you can give us some indication of when you'll get back to us, that will be great. I mean, we've sort of said to the team there is, you know, some money in the budget, but we don't know what that looks like. We've got some carried forward funds, but I'm just conscious too that there is a lot of anxiety in our workforce. So if we can have a date or some indication of how long that's going to take to do that piece of work, at least we can message that to our teams.
I can't give you an exact time, Dee, other than to say we're really cognizant of the concern in the sector. We're really cognizant that that concern has got to be trickling through to clients. We're really very cognizant about that. We're working over the weekends. We're having conversations with other parts of government. We're really pulling it together as quickly as we can. It's not something that we are sitting comfortably with and taking our time on, but there's a lot of moving parts that we that are taking some time to line up. So while I know that's not the answer that you are looking for, but with, you know, if we want to give a really good fulsome direction and advice to the sector, there's a couple of bits that we need to pull together. That said, we're working very long, 7 days a week over last weekend to do exactly that. So, yeah.
Thanks, Sherri. And thanks, Dee. I can imagine the anxiety that's going on the ground. Kathy Humphrey.
Thanks, Jenny. And look, Sherri, I'd really like to acknowledge the efforts of you and your team. I know it's difficult to get the outcomes that you would have liked as much as we would have liked. And it is good to see growth in there. I must say, I haven't been around for a long time. You know, there's many a year where there was no growth in homelessness. So we appreciate the efforts of what you've got in there. I guess my comment's more about, we're on the cusp of the 10-year strategy being launched, and you know, there's significant opportunities there around the reform of the homelessness service system. And I guess I was disappointed to hear the Treasurer's comments about the lack of outcomes and the evidence that rough rough sleepers are back out on the street. I just felt like that disconnect between the efforts of the sector, the efforts of the department hadn't been relayed to Treasury, that we are actually having outcomes, and the evaluation, I'm sure, will tell that concrete story when it comes through. But I think there's a missed opportunity. I think we've all got workforce difficulties. We've got lots of vacant roles. So we've got a workforce that's in H2H that would nicely transition into the new reformed environment that we're heading towards, around the integrated supports. I just wonder whether there's an opportunity for the department to line up the investments that's been announced off the back of the scaling down of H2H, so that we can take up this opportunity rather than just have one program finish and then kind of work out what we're doing next. So I'm imagining you're doing that, but it would be nice, I guess, for you to share that narrative when you can.
Yeah, of course, Kathy, and we're happy to share that. I mean, as everyone on this call would be very aware, that we're funded according to the budget bids that we put up for consideration, and thinking about that new investment that's come out and how we look to leverage that in the best way that we can towards new ways of working, but also acknowledge that the impact that H2H is currently experiencing, but also our need to play within the fence line of the playground that we're given. So, which is, again, to Dee's point, why I haven't quite nailed down when we can come back with advice, because there's quite a few moving parts in that, in trying to work that through.
Thanks, Kathy. Thanks, Sherri. Look, there's a question or a question in the chat from Mitchell Burney, I think referring to the fact that additional HEF will be needed if people start falling out of their accommodation and back into the crisis system. But I think it also goes to whether you can unpack a little bit more about the 75 million, Sherri, because Mitchell's wondering if a bit more of it could be used for HEF. But it's I think we've got a capital project in the first year and then some, if you like, pilot reforms in the following few years, 3 years.
Yeah, and that's the work we're unpacking, because it's there's what the department puts in a budget bid, and then there's what the decision that comes back looking like, and it can take a bit of time to marry up those two things to make sense of that sometimes. In terms of HEF, look, obviously an Aboriginal access point will require HEF, so there is scope within that new allocation to be thinking about HEF, and also thinking about within that what sits behind an Aboriginal access point in terms of support for people to navigate pathways out of homelessness, and some flexible brokerage that sits along with that. That said, the Aboriginal access point and associated funding doesn't kick in until next financial year, and it gives us some time to work with the ACOs in a self-determination process on what that funding would be best, how that service design should be implemented, how that funding is best used to serve the needs of the Aboriginal community. So in terms of HEF, that's a specific line item. In terms of, Jen, to your question about colour and movement and what does the rest of that look like, I guess we're just unscrambling the omelette, to be completely honest, at this point in time, of being able to pull out component parts of the broader business case and see how we can move that forward. I guess though, we have been talking to the sector for quite a long time about updating the way that we contract, or our service guidelines. So that whole 13 weeks of support you know, being quite outdated at this point in time. So really we're looking to leverage that funding for new ways and new innovative ways of working, ways that have an evidence base behind them, ways that, to be frank, a lot of our services are already working in. They just don't really align with the guidelines that the department has in terms of a more modern approach to supporting people out of homelessness. So we're working through that at the moment.
Thanks, Sherri. Now, no more hands up and no more comments in the chat. I've seen a lot of nodding heads as other people have been speaking. Does anybody else want to make a comment about what's happened in the budget? Lisa.
Thanks, Sherri. I was just wondering, as part of that review, will that also include, while we're looking at a new way of doing things, will that also include a review of our current funding and service agreements so that there's some analysis if services are being funded adequately?
Yeah, thanks, Lisa. Nice to see you. Yeah, it is about bringing the current guidelines that have, you know, some pretty like if we look at THM for an example of support there, it's a 1 to 12 ratio, 13 weeks of support, and it's a fairly formulaic funding arrangement that we have with the KPIs that sit alongside that. We've heard from the sector pre-COVID, we had a lot of consultation with the sector about what's working well and what they'd like to see improved in the homelessness service system. And we heard loud and clear that better ways of being able to tailor the support to people that meets their needs, whether that's a more intensive or whether that's more light touch, and that our funding guidelines aren't flexible enough to allow that. So certainly that's the feedback that we took from the sector. That said, we've since had COVID, so it's the onus is back on the department now to come back to the sector and test some of that thinking and test that the what we heard before COVID, and that fact that people have had an opportunity now through, you know, much more innovative funding rounds that we've had through those COVID supports that have really turned everything a bit upside down, and the sector being really innovative of how we use the funding that we have. So it's the onus is back on us to come out and make sure that what we're designing is in line with the sector's expectations and has an evidence base behind it to do what we're all hoping to do, which is either end or reduce homelessness.
Thanks, Sherri. Are we all done? No more hands? No more questions in the chat? Suitably subdued, I think.
So Jenny, maybe I can talk about next steps from here.
Yes, if you would, that'd be great.
Yeah, thank you. So, you know, obviously there's some work going on at the moment with H2H and the funding for H2H. So we're working very quickly on getting out advice to our funded agencies and then advice to the sector more generally on that program. In terms of the announcement of the new funding, including the capital and the operations dollars, we're working through that at the moment. We're hoping to come out within the next 4 to 6 weeks with some directions and some ways for the sector to engage in how we're designing some of those outcomes as well.
Thanks, Sherri. Well, I have to say it does, I think as a sector, it doesn't give us any pleasure to be upset with the Victorian government, who has been, you know, absolutely brilliant in terms of the COVID response. The hotels, I think they wore you all to death just about getting people in and out of hotels, and then the very welcome Homeless to a Home funding. Now, we all know that the Homeless to Home funding service design wasn't perfect, and we've got the preliminary evaluation and the ongoing evaluation, I think, to give everybody the opportunity to get the actual design of the model right. But it's not going to happen on its own, the funding to help the the most complex people in our human services system that end up being seen by us in the homelessness service system actually keep that housing that this initiative, these government initiatives have helped them to get. So we're still looking for that 1,845 spots to be continued over time. But I thank you, Sherri, for being with us today in these circumstances and giving us, a very strong and clear picture of what has happened. And we know that you will keep us up to date, you and your colleagues, as that sort of clarity emerges. I thank all, where did we get up to? All 196 of you for being here with us today at such short notice. Again, thanks to Una for being here on the COVID side of things. And we'll all do our best to keep you posted and to manage this huge disruption through making sure our clients are safe and that our staff are reassured. Thanks for being here, and we'll be in touch.
Thanks, Jenny.
Okay, bye.
Jenny and Sherri.
Thank you very much.
See you, everyone.
Bye.
Bye.
See you, everyone.
Bye. Thank you.
Thanks, Jenny.